Hello, my dear students. So today here I am to discuss and to introduce you to the Anesthesia Resident Masterclass, something that has been going around since about 2 years now. And this is not something that we are doing today. It's just I have reformatted the entire course. And so I'm here to discuss the new format of this amazing resident masterclass, which appears like this when you open the DAMS eMedicoz app. So I'm Dr. Anshul Diwakar. I'm your faculty of anesthesia. I'm a faculty at Delhi Academy of Medical Sciences, DAMS, as you all must be knowing. I'm also a D8 DNB in anesthesia with a degree in postgraduate diploma in medico legal systems, and I consult as a medico legal specialist for a lot of firms. And I am a faculty at national and international conferences, and I go and deliver talks on financial planning, as well as I am the conductor of this anesthesia resident masterclass, which is a comprehensive way of dealing with all the questions that are asked in theory as well as practical in your diploma, DNB, or MD exams in your anesthesia post graduation. So today I'm here to discuss about the specifics of this course and how we have approached the topics and how we have divided them. It's a short introduction to the course. So the past, the present, and the future. So without looking at the past, we cannot decide our present, nor we can look at the future. So in 2023, and actually in the end of 2022, somewhere around November, December of 2022, lot of my students who have been taught by me the subject of anesthesia for their undergraduation, that is your NEET pre-PG exam, they while they were doing their anesthesia residency, they approached me and they said, "Sir, we need some help regarding things in anesthesia PG as well." And so I, being what I do, and I'm a heavy working professional anesthetist along with a intensivist managing a small ICU, I was very skeptical that after so many years of passing my own DNB exams, which happened in 2017, will I be able to do something for my students. So with this thought, I started with one of the most basic approaches to discussing anesthesia. So I tried to find out, and I have always known that anesthesia machines and airways and different types of airways, the gas laws, the vaporizers are never being taught in any medical college in India. So what I did was I took a small step and I made a module which was only based on the anesthesia machine, the airways, and the difficult airway algorithm. So that was the first step that I started. And then looking at the overwhelming response of the students in module 1, I then decided to keep on adding different modules. And so the module 2 was again the things that were expected and in the exam but are never taught, is the critical care, the mechanical ventilation, the modes of mechanical ventilation, the weaning, the most important part of respiratory physiology, which is often asked but never discussed. Then module 3, we did extensively about drugs used in anesthesia, all the anesthetic drugs. And then in module 4, I went on to discuss topics related to the subspecialties in anesthesia, that is cardiac, neuro, pediatric, obstetrics, geriatrics, uh, and some miscellaneous topics which are asked but never taught, and it is not very well given. So this is what we have already done. We have already covered about 100 plus topics, that includes about 120-30 videos in the anesthesia resident masterclass. We have done things in a module wise manner, but now I have rearranged the app and I'm going to show you the new interface of the app. My whole idea of taking these classes is to target the untouched, untaught, unheard, and ununderstood parts of anesthesia. So whatever you will not find anywhere is what I discuss, and I discuss them not only conceptually, but I also write all the notes along with you. So I am also wanting you to prepare for your exams. I am always wanting you to be you. I'm always wanting that you prepare yourself for the exams as well. All right. Now, We have managed in these 2 years to pass two DNB theories, two university exams, and three practical exams of DNB. So this is what we have done so far. 100 plus topics, all discussed conceptually, all notes written by hand, which are available in app PDF, and we discuss them in a way that we remember it, we understand it, and we are able to reproduce it. And that is my entire target of teaching you. It is not just PPT based teaching where I will come, there'll be a Zoom call, there'll be a box, and I'll just keep on clicking right, and 1.5 hour I'm just going to talk to you everything that is written in Miller's textbook of anesthesia and all the what you can say, all the other textbooks or all the other articles, and I'm just going to copy paste it and write to you and tell you the significance of this, significance of that. But what will we do with the significance if we don't remember it and we are able to write that significance in the exam? So my idea is to do that for you. All right. So whenever you open the app now, you see something like this. This is the front page of the app, and you will find here that there is a my course. So after you have bought the anesthesia resident masterclass, you have enrolled for it, then you will find in my course, you will see the anesthesia resident masterclass. And the moment you open this anesthesia resident masterclass, now you will see things in a, just a second. So now you will see things like this. Now I have divided everything in the list of topics. So now you can see we have ECG, we have pharmacology and anesthesia, basic sciences and equipments, special topics where we have discussed everything that is very commonly asked, which is not commonly taught, that is opioid free anesthesia, that is communication skills, ethics and anesthesia, then breaking the bad news and the protocols for breaking bad news, TIVA and TCI. We have discussed everything related to diabetic autonomic neuropathy and perioperative management of a patient with diabetes. And we keep adding special topics in this folder, then geriatric, neuro, obstetric. You have cardiac and thoracic, pediatric, ICU, airway management, and thoracic anesthesia. So everything, if you are preparing for your exam, you know these are the topics that are commonly asked, and this is what we have discussed. So now when you click on each folder, you have these topics that are divided in each folder. So this is the folder of the anesthesia machines and the airways. So you can see gas loss, supply, machine 1, 2, vaporizer, breathing circuits. In management, you have airway management, LMA, laryngoscope, tubes, double lumen tubes, difficult airway algorithms. If you see at thoracic anesthesia, so you want to know everything about thoracic anesthesia at one place, but it is divided into three different parts. There is the part of the physiology, then there is a part of preoperative evaluation, and then there are the parts of thoracic anesthesia that are asked in the exam. So everything at one place. You discuss the physiology, oxygen transport, flux. All of these are very important exam questions. Then ECG. Now, ECG is a topic which haunts us a lot because it is not only important clinically, but it is also important for the exam. So I have my very dear friend Dr. Jay Mulchandani, who has helped me and make this topic extensively easy for you all. He is a renowned faculty of ECG who takes ECG classes all over India and has an offline program for an entire day for physicians, for intensivists, for even general practitioners in Pune. And he has agreed, and we have this extensive discussion of ECG. You can see we have divided it into so many parts that whenever you want to revise one part of the ECG, it doesn't really make it very heavy. So you have the introduction with arrhythmias, then you have intervals, that is your QR interval, your PR interval, your QRS interval, your QT interval. Then you have access and hemiblock, you have chamber hypertrophy, you have QRST and MI, you have hypothermia and electrolyte disorders, and then there are some practice clinical cases. So once you do this entire discussion on ECG, I'm sure you will never miss an ECG in your life. Then obstetric anesthesia, we discuss everything that is extremely important, physiological changes. Again, in DNB, we got a question, amniotic fluid embolism, mitral stenosis, retained placenta, anemia and pregnancy. And then you have these unique topics which are commonly asked, but we don't know from where to prepare, like TIVA and TCI. And this is one of the best sessions. There is maximum YouTube views also. I have dealt with this topic in such great detail and with such ease that despite of it being a topic of mathematics, you will actually end up remembering everything about the topic. And TIVA is a very common question for your exam, but we never really understand TIVA and TCI to write in the exams. Then written informed consent, breaking bad news, ethics, diabetes, diabetic patient, hepatorenal syndrome, which is again a very less heard entity for your exam. So this is the app interface, and this is how we have approached, and we have done it in an amazing manner. And there are so many students who have got benefited from this anesthesia resident masterclass. We are already standing at about 600 students who are a part of this course, and I would want each and every one of you to get an idea as to what my way of teaching is. So what you can do is you can just log on to YouTube and you can try and find this DAMS eMedicoz YouTube channel. And I'm sure you must be a part of DAMS eMedicoz, but anybody who has prepared for their entrance exam is a part of this channel. But now if you go to the playlist section, then you will find that there are so many playlists that have been made, and in that there is anesthesia residency guide playlist. You can subscribe to this playlist and you can watch. There are these videos that I have uploaded just to give you an idea as to my way of teaching. There are some demo videos like newer modes of ventilation, mastering total intravenous anesthesia and target control infusion. I have also recorded lot of non-academic videos for you to get help in your residency. So it is not just, we are not here just to cover the part that is important for your exam, but I want to guide you with my experience of over 10 years of being a teacher and being trained from the best institutes. I have tried to find a way for you to progress in the future. So if you are a diploma candidate, then I have a video on how to progress to PDCET, how to build an impressive CV as an anesthetist, how to approach academics. So every non-academic video is uploaded here, and you can go ahead. If you want to pursue future in UK or Australia, I have a video on that. If you want to pursue a career in critical care anesthesia, I have a video on that. So I am going to be there to guide you at every step, and I'm going to make sure that you don't feel that this is just a course. This is not just a course. It's a way of networking yourself to building a very, very good understanding of the futures of anesthesia and how you want to lead your life as an anesthetist. So that was the past. That is what we have already done. What we are doing now. So you will say, sir, आपने इतना सारा कर लिया, but अब क्या? So what we do is, now we have reached a stage where we discuss topics on demand. So when you enroll for the course, then you are a part of a dedicated WhatsApp group, but that is only for the students who have taken up the course. So not everyone else. It's an elite group of students from all the medical colleges in India, all AIMS, PGI, JIPMER, every big medical college. We have got students and they are very active and they participate very well. Now our current focus is on recent advances that is usually asked in paper 4. So we have university papers of almost all states that the students have put up, and I've compiled a list of the topics that we want to discuss. Of course, now the course has become dynamic. Now we keep adding 2 sessions per week, and now it is dynamic. So you want me to take a topic, you just put up the message on the group, so can you take this topic, and in a week or 2 I just happen to find time to do that topic for you. So now it is a very dynamic course. So now we are not doing things module wise, because we have anyway covered 80% of what is commonly asked in a theory exam already. The topics that I have discussed are extensively researched topics that are commonly asked from the past 3 to 5 years of paper. So if you do each and every topic that I have already taught, that is about 100 topics, that is about 120 videos, then automatically you reach a stage where you are able to know, remember, and you are able to pass your theory exams and practical exams. So passing is not a problem at this stage, but we want to become better. We want to achieve gold medal. We want to top the exam. We want to know everything about everything. So we keep adding on to our knowledge. We keep adding on to our course. The focus is always to discuss a topic and make sure we are able to write it. So my idea of teaching is not just to teach the topic. My idea of teaching is that after you are done with me, you know the topic, you understand the topic, you remember the topic, and you are able to write the topic. And that is what I bring new and extra to the table. Clinical case discussions and sharing of ideas, and read PPT, which is one of the most common question asked on my WhatsApp group. That is, do you have PPT for this? Do you have PPT for that? And of course, somebody has made a PPT and they do share. So that helps you with your the academics in your college, and you get ready-made PPTs which you can just read and edit. Of course, one of the things that I have done a lot in my residencies, I've appeared for quizzes and I've appeared for paper and poster presentations. So a lot of students take help from me regarding these things, and I do go out of my way and I help them. And so many of us who have just had a discussion with me while they were preparing their posters and while they were preparing for their quizzes have aced their quizzes. They have done exceedingly well. They have went on to national and international conferences and they have presented their papers, which have been appreciated, because when you get one-on-one guidance from someone like me who has done this thing a lot, then you do make a difference in your presentations. Now, a common question that is asked is, when should one enroll for the course and for how long, the duration? So I'll tell you, that is just like the criteria for pre-operative stoppage of smoking. There is an ideal, there is an advised, and there is a minimum. Ideal is when you do it in first year, because see, you can't dissociate your practice from your academics. That is a very, very wrong habit. What if you inculcate your practice and your academics? So even when you are in first year, and I know it is difficult in the first few months of residency, but once you stabilize, once you are okay with getting up, going, you're okay with being awake at night, and post call you come and sleep and you feel fresh, it takes about 2 to 3 months to get adjusted to the rigorous routine of first year. After that, I would recommend you to join. So ideal is if you join 3 to 6 months in your first year. I know it is not possible at the beginning, but I'm okay with that. I don't even want you to go for a course in the beginning. First, try and understand the OT environment, how to prepare drugs, what is your protocol, duties, have some fun, get some stipends which you can splurge on yourself, buy good clothes, good shoes, iPhone, iWatch, and do all those things that you always wanted to do before residency. Most of the time, students join at the start of second year. Why? Because the moment juniors come, that is when they realize that they don't know any theory. They know everything to do in the OT. They know how to prepare drugs. फिर जूनियर पूछता है, सर थायोपेंटोन क्यों देना है, सर थायोपेंटोन क्यों नहीं देना है, सर हमेशा प्रोपोफॉल ही क्यों देते हैं, सर स्कोलिन ही क्यों यूज करते हैं. Now you don't have answers to that. So second year is when you actually want to start studying, but you have too much of resistance. You always feel, हाँ कल करेंगे कल करेंगे कल करेंगे. So that is when you actually need to start studying. This is the time to build concepts and to make your own concise notes. This is the time to build concepts and make own concepts. So ideal is of course first year, advised is second, because जब time ज़्यादा रहता है आप अच्छे से पढ़ते हो, and not only that you will join my course and get taught by me, but you will also go and you will read those topics from standard textbooks so that you know कि जो मैंने पढ़ाया है उससे अच्छा और कोई नहीं पढ़ा सकता. दैट इज समथिंग आई कैन वाउच फॉर, क्योंकि मैं सिर्फ एक टेक्स्ट बुक से नहीं पढ़ा रहा हूँ. आई एम रीडिंग 3 4 5 टेक्स्ट बुक्स, आई एम रीडिंग ऑल द आर्टिकल्स, एंड आई एम यूजिंग लॉट ऑफ रिसोर्सेज टू कंपाइल द बेस्ट वर्जन फॉर दैट पर्टिकुलर टॉपिक. But still, you have to get into the habit of reading the books. So there is no harm if you go and you read the books. That is only possible when you have time. So when you start in second year, you have 2 years in front of you. And second year is when you can apply the theory to the logic, to the application in the OT. तो अगर आपने laparoscopic concerns, एनेस्थेटिक कंसर्न्स इन लैप्रोस्कोपिक पेशेंट पढ़ा, तो अगले लैब केस में आप उसको अप्लाई कर सकते हो. आपको पता है जब न्यूमो क्रिएट होगा तो शुरू में देयर विल बी हाइपोटेंशन, टैकीकार्डिया, देन देयर विल बी ब्रैडीकार्डिया एंड हाइपरटेंशन. तो यू विल नो ऑल दीज थिंग्स व्हेन इट इज गोइंग टू हैपन. ऑलराइट, मिनिमम इज व्हेन यू आर इन फाइनल ईयर एंड नाउ यू हैव टू पास द एग्जाम. देखो सबसे बड़ा है अब आपको पास करना है एग्जाम को, राइट. तो अब यहाँ पे आके आप अटक गए, तो अब आपके पास टाइम कम है, अब आपको हेल्प चाहिए है, तो अब आप ज्वाइन कर लो. तो आप कभी भी कर सकते हो, एट द स्टार्ट ऑफ थर्ड ईयर, इन द मिडिल ऑफ द थर्ड ईयर. आई हैव स्टूडेंट्स हु हैव जॉइंड इन द लास्ट फ्यू मंथ्स एंड आर एबल टू वॉच ऑल द वीडियोस, क्योंकि अब तो लगी में भगी है. यू हैव टू डू इट, सो यू हैव जॉइंड इट. ड्यूरेशन, I would always recommend, with the content that we have, you join for at least 1 to 3 years. If you are in first year, then join for 3 years. Second year, join for 2 years. Third year, join for 1 year. But always remember, join it in a way that you time it so that the course validity is still your practicals, because all the things that we discuss in theory are also very, very relevant for the practicals, and I keep adding new sections for your help. But yes, I do give you an option of 1, 3 and 6 months in case you don't want to give such long commitment, which is a lot of issue with the people, and you don't have a conviction of reading right now. You don't know whether you're going to take a subscription and you're going to use it. So there are so many students who joined for 1 month, they watched the videos, they felt better about it, and then they took a subscription for long term. Future. What is the future? So I told you the present is that we keep adding 2 topics per week, so that by the time we are July or August, we would have added say about 30 topics more, which are very very important for the recent advances. So by the time we reach August, then more or less we are done with whatever we need to do and remember. Then we'll just keep adding one per week, whatever you guys will be asking. But yes, I want to do more for you. So I want you to go ahead, and this should become your single pit stop for all anesthesia needs. So for your PDCET, that is, if you're a diploma candidate preparing for PDCET, or your NEET SS, or your EDAC, or your FRCA, then I'm thinking of adding some MCQ modules. So there'll be MCQ followed by a discussion, and there we will discuss the core concepts that are relevant for those exams. Of course, this is something that I'm going to do in the next 1.5 months. That is the OSCE trainer. And this OSCE is very, very important because these days even universities are switching to OSCEs, and OSCEs with timed slots. So when you open it on the app, then you will get an image, you will get the number of questions, and it will be timed. And after that time, it will change. Clinical case discussions based on the preparation of the topics. So that is something that we keep doing from time to time. But this is something that I'm starting from next week. And this is the rapid review and revision series, that is the RRR series. And this is how I prepared when I was in my DNB, preparing for my DNB. I sat with one of my friends and we decided for every topic, we are just going to discuss that topic in 10 to 15 minutes. 10 to 15 minutes per topic. So in the last 1 week of your exam, it can serve as a podcast to you. If you start just listening to the RRR series, then every 10 to 15 minutes, one topic is done. So if you listen, say 2 to 3 hours of my RRR, then 10 to 12 topics you revise in a day. In the last week, this is what you need, because you cannot keep on going reading the books. So this is extremely high yield that I'm creating. And for all the topics that we have discussed, there will be an RRR series where we are going to quickly discuss these topics so that we make the best out of it. So this is my approach, and that is why I have redefined this entire anesthesia resident masterclass. Now it is no more based on modules. Now it is an open, this is an open masterclass. Now the topics will be twice per week, and everything that is there, even if you join today, by the time you start watching the new videos, it would be 4 months from today, because that is the amount of content that is already present on the app. And I have never found somebody who has not liked my way of teaching. Of course, you can always give it a try. There is a free trial option, and you can always start with a smaller module or a smaller subscription, that is 1 month. But yes, we will not disappoint you. We are here to help you, and these are the ways you can reach us for any queries, for discounts, for enrollment, anything you want. This is my personal WhatsApp number. Please WhatsApp me on this number whenever you want to contact me. You can of course directly download the damn eMedicoz app, and you can find the resident NEET SS and resident class section, where you will find anesthesia and you will have this course, or any of the DAMS helpline number, or any of the DAMS person that you are in contact with. And we are welcoming you to this anesthesia resident masterclass, and I hope that I make a difference in your approach and your journey towards the anesthesia residency and your final exam. So I hope this video finds you, and it finds you well, and I hope that you now have a better understanding of how we are doing things. And if you have any queries, then you are always welcome to ask me. Thank you so much. Bye.